Let's talk about a silent health issue, one that millions of people are dealing with every single night, often without even knowing it. It's a condition that can turn your own body against you while you're asleep. But what if the answer wasn't some complicated machine, but something as simple as training your body to fix itself? So let's really think about this for a second. Imagine the single biggest threat to your long-term health isn't something you do when you're awake, but something that happens over and over again while you're fast asleep. For millions of people, this isn't some scary thought experiment. It is their nightly reality. And to really get a handle on that reality, you have to understand the sheer scale of this problem. The numbers are frankly staggering, and they show just how connected this one condition is to some of our biggest health crises. Okay, just look at this number. A whopping 80% of people who have high blood pressure that doesn't respond to medication, for them, the root cause isn't something they're doing during the day. It's what's happening at night. And believe me, the connection to heart health doesn't stop there. It gets even deeper. Somewhere between 50 and 80% of all patients with heart failure are also dealing with this exact same underlying issue. And then you have atrial fibrillation. You know, that irregular heartbeat? The overlap there is a massive 50 to 70%. So the picture here is crystal clear. The way we breathe when we're asleep has a direct, powerful link to the health of our heart. So what is this thing lurking behind all these statistics? Well, it's called obstructive sleep apnea, or OSA for short. And this isn't your brain just forgetting to breathe. No, this is a physical problem. When you sleep, the muscles in your upper airway can relax way too much, causing them to collapse and literally block off your air. So how do doctors even measure this? They use something called the apnea-hypopnea index, or AHI. It's actually pretty simple. It's just the number of times you stop breathing per hour. Anything under 5 is considered normal. But for some people, it gets really severe, with 30 or more of these events happening every single hour of sleep. All right, so if this problem is so widespread and so serious, what do we do about it? Well, for decades, there's really only been one main answer, but it's an answer that a lot of people just can't live with. It's definitely time to look beyond the mask. You've probably heard of the go-to treatment, the CPAP machine. It stands for continuous positive airway pressure, and it's basically just a small air pump that's hooked up to a mask you wear at night. It's incredibly effective at forcing your airway to stay open. But, and this is a big but, it's notoriously difficult for people to tolerate and use night after night. The fact that so many people struggle with CPAP has really pushed researchers to look for other options, and it led them to ask a really simple but kind of brilliant question. What if, instead of using a machine to force the airway open, we could just train it to stay open on its own? And that is exactly where orofacial myofunctional therapy, or OMT, comes in. The easiest way to wrap your head around it is to just think of it as physical therapy, but for the muscles in your tongue, your throat, and the roof of your mouth. It's an active approach, not a passive one. Now, this is where it gets really cool. OMT works on so many different levels. It's not just about building up raw muscle strength. It's also about retraining your nerves so they're less sensitive, which helps you sleep deeper. It's about improving the whole muscular system that keeps your airways stable and open. But of course, the big question is, does this airway workout actually work? Well, the science is in, and the results are honestly pretty amazing. They show some major improvements, way beyond what you'd expect from just a few simple exercises. And you know, it's crucial to understand this isn't some brand new, unproven trend. The research behind OMT has been building step by step for more than a decade. It started with some groundbreaking studies back in 2009 and has evolved all the way to today's app-based therapies. The evidence just keeps getting stronger. Let's actually go back to that very first big study from 2009. Get this, researchers had people do about 30 minutes of exercises every day for 3 months. The result? A remarkable 39% reduction in breathing events. And hey, for anyone who's ever slept next to a snorer, it also cut the power of their snoring by an incredible 59%. So how does OMT stack up against other treatments? Well, it really carves out its own unique space. Sure, a CPAP machine might be better at just bringing down that raw AHI number, but OMT shows incredibly strong results at improving daytime sleepiness, and it has virtually zero side effects. It really targets your quality of life. And all of this kind of points to a much bigger, more profound idea. Maybe the best solution here isn't just about a new therapy. Maybe it's about reclaiming the way our bodies were always meant to work in the first place. You see, researchers have pointed out something incredible. If you go back just a few hundred years, the physical problems that cause sleep apnea today, things like narrow jaws and crowded airways, were almost non-existent. They were incredibly rare. So what changed?
Well, the leading theory is that it all comes down to our food. Our modern diet is, well, it's soft, it's processed. It just doesn't give our jaws the workout they need to develop properly. Our ancestors, on the other hand, they were eating tough, fibrous foods that forced their jaws to grow strong and wide, leaving plenty of room for an open airway.
So what this really suggests is that maybe you were thinking about this all wrong. It's not just about fixing the problem once you have it, it's about prevention. It's about rethinking our basic habits, from the food we eat to develop our jaws, to something as simple as making sure we breathe through our nose, which helps keep the tongue and airway in the right position.
And here's the really cool part. We're using modern tech to help us get back to this more natural state. There are now these amazing non-wearable sensors, things like millimeter wave radar, that can track your breathing while you sleep without even touching you. And there are apps that can walk you through the exercises, making it easier than ever to stick with it and see your progress.
So, I'll leave you with this to think about. As we're all searching for the next high-tech solution to our modern health problems, could it be that the most powerful answer, the key to unlocking better sleep, isn't hidden in the future, but in our own past? Maybe it's just about reclaiming the natural strength our bodies were always designed to have.